Welcome! We're here to give you some guidance about what you can expect before, during, and after your upcoming orthopedic surgery at Dignity Health Yavapai Regional Medical Center. Did you know that YRMC is recognized as having one of the top joint replacement programs in the country? In fact, orthopedic surgery is offered at both of our hospitals, in Prescott and Prescott Valley. One of the biggest reasons for our great reputation is our top quality healthcare team, some of whom you'll meet today. Studies show that patients who understand what to expect and are prepared ahead of time are more likely to have better outcomes, and they get back to doing the things they love sooner. So, for the next few minutes, we'll hear from several of our healthcare experts. The main goals of your surgery are to improve or stop your joint pain, to get you back to walking, driving, and enjoying your daily activities and hobbies, and to help make you less dependent on others for care. So, let's get started. Here are a few practical tips to help you each step of the way. Soon, you'll be on the road to recovery. It all starts long before the date of your surgery. First, take a look around your home. Make sure you have a chair that's easy to get in and out of. Set up a safe bathroom, including a nightlight, commode seat riser, and grab bars by the toilet. Non-skid decals and grab bars in the tub or shower, as well as a shower chair, are also important. Remove tripping hazards, such as stacks of newspapers, electrical cords, loose throw rugs, and other items. Get a walker or cane if your healthcare team recommends it. And remember, nutrition will play a critical role in your healing. Make sure you've stocked your kitchen with healthy foods.
Nutrition is just an important part of your recovery process as the medications that the doctors are going to give you and as the physical therapy and occupational therapy that you'll go through. There are three main nutrients you want to focus on after surgery. You want to get lots of protein because that promotes wound healing, and you want to focus on fiber and make sure that you're well hydrated because that will help prevent constipation from the medications that you're going to be taking. So you want to aim for 20 to 25 grams of protein per meal. That's a good amount per meal. So for example, you could have like 2 eggs and 2 pieces of buttered toast and some orange juice for breakfast. You could have a sandwich made with turkey and cheese and have an apple and half a glass of milk. For dinner, maybe have like a 3-ounce piece of chicken, which is about as big as a deck of cards, and some rice and some vegetables.
Here are a few things you'll want to put in place prior to your procedure. Make arrangements ahead of time for transportation from the hospital after you're discharged. Make sure you complete your pre-surgery exercise program. Complete a physical exam to ensure you are safe for surgery. Your healthcare provider will discuss this with you. You may need to have an EKG, blood test, urine test, and/or chest x-rays. It's also helpful to choose a support person to be there for you along the way.
It's important to have a support person for a number of reasons, and probably number one is they're an extra set of ears as you're talking to your surgeon. They can take notes for you and help you remember what that surgeon might have said prior to your surgery. Obviously, the day of surgery, they're a great moral support as you're getting ready to go to surgery, and after surgery, they are essential for good healing. They will help support you when you get home. They're there to help you make sure you get your medications on time, that you're eating good, nutritious food, that there's somebody to take care of the pets even. And they're also a really good support if you're going to go to rehab.
Be aware that your surgical team may ask for some background information about you prior to your surgery. This may include your medical history, family history, and current medications, including over-the-counter vitamins and supplements. Any allergies or sensitivities you may have. Copies of your medical records, especially those that relate to your current orthopedic condition. And of course, any questions or concerns you may have. To help make your recovery easier, here are a few things to consider well before your hospital stay. Where will you be headed after discharge? We'll talk more about this later in the video. If you're headed home, will you have a support person to stay with you around the clock for 1 to 2 weeks? Do you have the equipment you'll need? You may need a walker, cane, shower chair, and/or a raised commode. YRMC Care Management can help. And if you have stairs, you may not be allowed to climb them right away. What accommodations can you make? Finally, bring these items along with you the day of your surgery. A list of current medications and over-the-counter vitamins and supplements. A list of your drug and food allergies and sensitivities. Your insurance card. Copies of legal documents such as medical proxy, power of attorney, or living will. The name and phone number of your primary contact while you are in surgery. Loose-fitting clothes for after your surgery. And be sure to leave any valuables or jewelry at home. During your hospital stay, your healthcare team has 4 main goals: a successful surgery and recovery, controlling your pain with oral medications, getting you up and moving, and preparing you for a safe discharge to your home or care facility. Rest assured, you'll have a team of highly skilled healthcare specialists ready to care for you.
There's quite a few specialists that work together as a team to make your experience here at YRMC as pleasant and successful as possible. Your YRMC inpatient team includes your orthopedic surgeon, anesthesiologist, nursing services, care management, physical rehabilitation services, dietary services, and respiratory therapy services.
A physical therapist is a therapist that will come into the room after surgery, and we will work on range of motion, which means moving your surgical limb through the range, available range at that time. We'll also work on bed mobility, which means rolling left, right, maybe sitting to the edge of the bed, getting out of bed. And then we'll progress that into transfers. It could be as simple as just sitting at the edge of the bed up to standing. And then we can try transferring to toilets, things that you're going to have to transfer up and down to at home, toilets, chairs, different things like that. And then we also work on gait training, which gait means walking. So we'll work on getting you back into a small sequence of walking. And we also will work on strengthening. We will also educate you on your weight-bearing statuses. What that means is the doctor or surgeon will choose whether you can put full weight bearing or your weight bearing is tolerated, or what they call partial weight bearing, which could be 50% or 25%. Each doctor kind of picks depending on how the surgical approach was taken or how much time they may estimate that you need for healing.
An occupational therapist is someone who helps you complete your self-care, like bathing, dressing, toileting, after a trauma or a surgery. We go over specifics about bathing, dressing, and toileting and how to accomplish that should you have any barriers or limitations after whatever has happened. I might bring with me some tools that include a sock aid, which helps you put on your socks. You use it to shimmy the sock on, and then you pull it all the way up, and because you can't bend forward most of the time because of either pain or just limitations. And then we have a long-handled shoe horn that helps you take your shoes off and on without them folding at the heel. This helps prevent that. And it's longer so that way you don't have to bend over as well. And then we have the grasper. You can use it for clothing, but this is the main one that helps you around the house. Should something be too high and you need to reach it, or too low and you need to reach it, this is a great help. So these are really handy. We will go over the precautions that your doctor may give you after the surgery, and it doesn't always happen. It depends on the doctor and it depends on the situation, what happens during surgery.
So it's important to talk to your physician prior to your surgery about what your discharge destination might be. The most intense and probably the most rare is going to be acute inpatient rehab. 3 to 4 hours of therapy a day and 7 to 10 day stay. After that, you'll go back home, might follow up with some home health care. The next step down, and probably more frequent destination, is going to be a skilled nursing facility where you're going to spend 2 to 3 weeks at the skilled nursing facility and get about 2 to 3 hours of therapy a day. Again, with the overall goal of getting you back home and back functioning probably better than you were prior to your surgery. Of course, there's always the possibility of going home with some home health care. Home health is when an outside agency comes into your home 2 to 3 times a week, about an hour per stay. The therapist will come directly to your home, get you rehabbed, and back to your good old self. And probably the very least is you go home and you come to an outpatient therapy center to get your therapy at that outpatient clinic, maybe 2-3 times a week, depending on what your surgeon thinks that you're ready for in getting your strength back and back to your good old self.
Regardless of your discharge destination, so much of your success depends on you. You'll follow up with your surgeon to ensure your joint is healing. Be sure to cooperate with your therapists and participate in your care. Do your assigned exercises. Comply with any joint precautions, and be sure to follow any weight-bearing instructions you've been given. Most importantly, get up and move. Our goal at Dignity Health Yavapai Regional Medical Center is to get you back as soon as possible to the activities you enjoy. We hope we've been of help as you prepare for your upcoming orthopedic surgery. For more information, or if you have any questions, don't hesitate to give us a call. Thanks for joining us.